Hey, I'm Dr. Brian McKay, Neuropathy at CoreHealth. I want to talk to you today about the agony of the feet, not the agony of defeat, the feet. So, what happens is peripheral neuropathy is very much misunderstood. People will just start taking Lyrica, Cymbalta, gabapentin. Those are the typical things because of medications. You have a problem, you go see your medical doctor. He says, "Well, we've got this." What you don't know is that these medications are primarily designed for anti-seizure, antidepressive. When people can't figure things out, they just want to throw medication at it. Medication is not going to solve your peripheral neuropathy symptoms. Neuropathy will arise from chemotherapy. The toxins that kill the cancer also kill the nerve covering, which prevents the nerve from functioning. I mean, you might not be aware of it, but the nerve travel at 270 miles an hour, specific nerves that go from your foot to your brain. So imagine it traveling 270 miles an hour. Well, when that gets interrupted, the brain's not happy and pain will ensue. It doesn't start out that way originally because most people aren't aware that you have 31 spinal nerves on each side of the body. And when one nerve comes out, it's a cable, and there's 9 different wires within that cable. 4 of them have to deal with light touch, vibration, deep touch, and the sensory input. So that's usually where it starts first, is those that we call large diameter afferent nerves. And so when it's damaged, the brain cannot effectively communicate with that body part. So when it starts out as numbness and tingling, will slowly progress to a sharp burning sensation in the feet, possibly keeping you awake at night. When you're at that pain stage, there are 6 nerves involved. Initially, it's just 4, but it becomes a downward cycle. And then also, too, is you have the nerves that control blood flow, and those are involved as well. So what happens is there's a lack of blood flow, which messes up the nerves. There's a lack of nerve communication, which messes up the nerve-brain communication. And chances are there's too much glucose running around if you're diabetic and you're not regulating your insulin, or if you're post-chemotherapy patient, you're going to have to understand there will be damage to these nerves. And these nerves are further away from the heart, so it's going to affect typically the feet or the hands, and typically the feet because there's a much greater distance from the heart than the arms and the hands. So you got peripheral neuropathy. What are you going to do? Well, there are a number of different therapies, and on Tuesday, December 8th, we're going to do an open house here at Neuropathy CoreHealth. Now, why an open house? Because a lot of people have questions. They may think they have small issues. Well, what we're going to do is everyone who attends is going to get a free thermal imaging scan. Typically, we charge $47 for it. You show up for the lecture, you're going to get the free thermal imaging scan. This is going to show you in I would say black and white, in living color, whether or not your feet are getting the blood flow they require to sustain itself. Now, you may think it's really simple that, okay, I have the numbness, tingling, oh, it hurts at night, I can't sleep as well, the burning pain, but this leads to loss of balance. Okay, nerves control balance. You have all these nerves in your feet, primarily a lot of them for balance purposes to let the brain know where the feet are at all times. So when that gets interrupted, your balance is off. Sometimes it feels like you're walking on glass. Well, not a good thing. So what we need to do is wake those things up. We have a number of different therapies. We have pulse electromagnetic field therapy to get the cells to heal, with the proper charge on the cell membrane. We do cold laser to stimulate production of adenosine triphosphate, ATP, which is the fuel that they use in the cell, the mitochondria of the cell. And the mitochondria is like the boiler for the cell, produces energy in the form of ATP. So that's partially what we do. Okay, we also have oxygen therapy to stimulate blood flow to the extremities, and it's a fantastic way to treat it. I mean, there are more studies on hyperbaric oxygen treatment to work with neuropathy patients, but we work it in as part of a package of a number of different things. So the oxygen, first we do is we put you on an exercise bike. You're on a breathing mask directly from a breathalyzer. No, it's not a breathalyzer. It's an oxygen concentrator. I'm sorry. So what happens then is we bring you down as if you're riding say you're riding a bicycle in Colorado where it's a higher altitude. So it makes it harder for you to breathe. So we want your body to be looking for that oxygen. Then all of a sudden we will turn the oxygen to 100% concentrated, super concentrated oxygen levels, and that'll help dilate the blood vessels, forcing more blood flow into the legs. Um, and that's a great way to kind of waken up, because a lot of times your nerves will travel in the walls of the arteries and the veins. So as we open those up for increased blood flow, which is a term we call angiogenesis. So those are just a few of the different treatments that we do here. We have a thing called the Hako-Med, which is a fantastic therapy from Germany that will help rebuild the covering on the nerves. Hands down, it will help rebuild that covering. Because one thing to manage your sugar, but you have to make sure we're managing that part properly. If that doesn't happen, we're not doing as effective a job. And so what we'll do is we'll go over all the different therapies we're using, and I invite you to come learn. I mean, the thing too is be concerned. If you have peripheral neuropathy and numbness and tingling is okay by you, well, fine, come learn, because as these cases become more serious, and they do become more serious because the medication, if it does work to work on the numbness and tingling or the pain, you're still getting worse, and your balance will be affected. And a lot of times balance issues lead to a fall, which leads to a fracture, which leads to a nursing home stay, which leads to a morbidity rate. Now, in the most serious cases, when you do not get enough blood flow to a body part, they will have to amputate, and that does happen. Seriously, it happens a lot more than you realize. But what I want you to do is be informed. Come to the open house Tuesday, December 8th, Neuropathy at CoreHealth, 551 Post Road in Darien, Suite 1. Give us a call, 203-875-0846, 203-875-0846. Come on in, and the least you can do is get yourself scanned with the thermal imaging monitor. It'll help right away. It's very point on. You'll know. All right, I'm Dr. Brian McCabe for Neuropathy at CoreHealth. Thank you for listening.